Thank you very much indeed, and very much welcome to Scotland, and apologies about the weather, but we have the Hurricane Gonzola to blame for the weather in Scotland today. Can I say this is a wonderful event to be held in Scotland because, like every other European country, we are facing the challenges of dementia with the ageing of the population and all the associated challenges that go with that. And many people don't realize that dementia can take many forms, Alzheimer being one of them, but there are over 100 different types of dementia. And while I speak here this morning as the Cabinet Secretary for Health and Wellbeing in Scotland, I also speak of someone who's had experience of nursing and caring for my late father, who himself suffered from Alzheimer's. So having been there and experienced that, I can tell you that there is much more to do, both in Scotland and indeed throughout Europe and the rest of the world, to tackle the challenges of dementia, including Alzheimer's. Certainly when my father was diagnosed, and looking back, there are a number of lessons I think we can learn. And one of the important lessons, of course, is the very importance of diagnosis itself. When you realize that your mother or father or relative or friend has been diagnosed with dementia, then you look back and you actually realize there were signs of the dementia long before the diagnosis. And of course, once the diagnosis takes place, the level of support, certainly at the time when my father was living, up until about 11 years ago, the level of support was nothing like what is required. So I want to concentrate today on telling you some of the lessons we've learned in Scotland and what we are doing in terms of taking forward the agenda to improve diagnosis, and then once the diagnosis takes place, to ensure that the person with dementia is being properly catered for and looked after. I also want to stress the importance that we have found of involving people with dementia in the policy-making decisions that are taken at national and regional and local level. You know, until recently, we have tended to ignore the people who are best placed to tell us what people with dementia actually require. And those are the people with dementia. Now, obviously, people who have advanced dementia are limited in terms of their contribution. But people who are in the earlier stages of dementia are well qualified to tell us what they feel is happening to them, what their priorities are in terms of how they are treated and supported, and not just in terms of what they actually need, but how they need that support delivered and by whom. Because while dementia is a medical condition, it is also a social condition. And one of the biggest dangers for people with dementia is the social isolation that can come with it. And of course, as we all know, that is exactly the opposite of what people with dementia require. Because social interaction, indeed more social interaction, helps them deal with the condition rather than isolation. And I think one of the priorities has to be that people with dementia, that they get the support in terms of the social interaction they need, not just with other people with dementia, but with society more generally than has been the case in the past. And therefore, when we are looking at this from a health point of view, in terms of health, we shouldn't just think about the mental and physical condition of the person with dementia. We should be looking at their social health as well as their physical and mental health, because the support they require is in all three fronts. And very often, what can be done by way of organizing an enhanced social interaction for people with dementia is as important, and in some cases possibly even more important than the medication that they're receiving from their doctor. And not just the social interaction in terms of being with other people, but also the challenges, for example, of being able to do things and do things that are challenging to keep the brain working for as much as and for as long as possible. And therefore, in days gone by, when we were much more ignorant of these matters than we are today, and hopefully today, when we take a more informed and progressive approach, then we do realize that it's important that people who have been diagnosed with dementia are not then written off as people who no longer have anything to contribute either to the development of their own lives or to the development of other people's lives as well. And therefore, for me, having been through the experience, that is one of the first big lessons that I learned, that my father was still a human being, he was still a functioning human being, and he had need for social interaction and not to feel isolated from the rest of his family, his friends, and the rest of society. And that's why I think it is a key part of any successful dementia strategy to involve people with dementia, not just in delivering the strategy, but in the design and development of the strategy itself, including how we deliver support services. And that is a very important lesson. And I know that other people in Europe are starting to do this. And I know as far away as Japan, the Japanese have been to Scotland to learn how we do that. And they themselves now are doing exactly the same, of involving people with dementia in the policy making. And I make a point on a regular basis as the Cabinet Secretary for Health and Wellbeing to meet with the networks and the groups that we have set up involving people with dementia, along with family, friends and carers, to make sure that they not only are involved, but that they feel involved and feel as though their contribution is valued, because they can tell us better than anyone what it is we need to do. The second, I think, important lesson is to improve the rate of diagnosis. Now, in Scotland, we have made enormous strides in recent years in improving the rate of diagnosis. And that's extremely important. Indeed, we are about 20% ahead of the rest of the United Kingdom in terms of a rate of diagnosis. But we still have some way to go. There are still many people out there who have dementia, but who have not yet been diagnosed. And let me also say in passing that we should not always think of dementia as being an older person's disease. In Scotland, we have nearly 90,000 people diagnosed with dementia, but about 3,000 of those people are actually aged under 65. And the services available to them, particularly financial support services, are quite frankly quite inferior to the support available to the over 65-year-olds. For example, for the over 65-year-olds, there is free personal care. But for the under 65-year-olds, there is no automatic right to free personal care because they are entitled to working age benefits. But because of the benefit reforms, many of the benefits and the generosity of those benefits have been substantially reduced. So one of the things we are doing at the moment is looking very specifically at the financial support mechanisms for people who have dementia but are under pension age, because we do believe there is a gap there in terms of support that needs to be filled. But in terms of wider diagnosis, if someone has dementia and has not been diagnosed with dementia, that has serious implications for them and those round about them. And the two most serious implications, I think, are first of all that people do not realize that they have dementia. And therefore, they are not treating these people properly very often. They are not giving them the support that they need just on a one-to-one basis. They're not giving them the dignity and the respect they need as they should be. And the second consequence of having dementia, but not having been diagnosed with dementia, is that you're not then getting the follow-up post-diagnostic support that you're entitled to and which you require to help map out your journey from diagnosis onwards. And therefore, the rate of diagnosis is the second biggest challenge we have. And while we are probably amongst the highest rates of diagnosis in Europe, I believe we still have a long way to go to further improve the rate of diagnosis. The third biggest challenge is once the diagnosis has taken place and someone has been diagnosed with dementia, it is a huge shock to their system and to their family and friends, and probably at that stage they don't even have carers, and one of the first things they might need is some care support as well. And therefore, the one-year post-diagnostic support package that we have in place now for people who have recently been diagnosed with dementia, I believe is critically important. It's critically important in a number of respects. First of all, if you've just been diagnosed with dementia, you have to transition from being pre-diagnosis to being post-diagnosis. And that covers a whole range of activity. First of all, in terms of what you do with your life as somebody with dementia. Secondly, your relationship with your family and friends and the rest of society and what impact the diagnosis is going to have. Thirdly, there's the most obvious one of the medication regime that you're then going to require, and that will be tailored to what type of dementia you have. And fourthly, there is the wider support mechanisms needed. There is the need for financial support. There's the need for a caring package. There is the need to plan for what is likely to happen in the future. Because as we know, dementia moves in stages, in phases, and every phase is different. The time that every phase takes is entirely different. And for me, having experienced it with my late father, the very worst period wasn't before he was diagnosed or in his late stages of diagnosis. The worst stage was in the middle bit, when it was a half and half type situation, when he knew in his brain that something was wrong, but couldn't work out what was wrong, and at the same time when he was having long periods of clarity, which was mixed with periods of darkness and forgetfulness, and when he was not realizing always what environment he was in. And that transition phase, that half and half phase for me was the most distressing period of all, because when he developed later phases, when he became more ill with Alzheimer's later on, he did live in a bit of a world of his own, and he was very happy in that world. He thought he was still living in his own home when he was in a care home. He thought he was still capable of doing many things that he was no longer capable of doing. But he was happy within himself. And that fact that he was happy within himself, being safe in a safe environment, being well cared for, actually allowed me and my brother and our families to relax a bit more and be able to know that what he was getting was what he needed. But the phase when he was in half and half, when he was traveling towards a much more difficult period, but still not knowing quite what's happening to him and for us, that was the most difficult period of all. And therefore, the immediate post-diagnosis period, I think, is in some ways the biggest challenge of all, both for the person with the dementia and for their loved ones and those caring for them. Because that is the difficult period when sometimes life is normal. It might only be for an hour or two at a time, and then it goes to being different again, and then it goes back to being normal, and it's difficult in that situation, which is ever-changing. And literally, from hour to hour or day to day with Alzheimer's can be very different and very difficult coping with that period. And I don't think we do enough. Even in the most advanced support packages, we're still not doing enough overall for people with dementia, but particularly for that middle period between diagnosis and the later stages. That by far, I think, for the person who's been diagnosed with dementia is by far, particularly I think with Alzheimer's, the most difficult period, and we need to do more to help people during that transition, during that phase. Now, I very much welcome the initiatives that were taken at the G7 and the follow-up to that, and Scotland will play our part, because ultimately the goal must be to try to find a cure for dementia and indeed understand better why people develop dementia in the first place. And that's not just about the economics of dementia. I mean, if in Scotland, which is, I don't believe, untypical of anywhere in Europe, nearly 10% of the residential beds in our hospitals are taken up by people with dementia. As roughly 10% of our entire budget now is going to people with dementia. But it's not a money issue. It's about the person, because we are having great advances in medical science, that it's extending our lifespan. But it's very important that not only do we extend our lifespan, which is good news, but that those additional years allow us to be mentally and physically fit to enjoy and appreciate the additional lifespan that we have. And therefore, the primary motivation isn't budgetary. The primary motivation in trying to drive towards understanding of what causes dementia and what can cure dementia has to be the humanitarian aspect, so that in years to come, hopefully, eventually, nobody will have to go through the experience of dementia, because we'll be able to treat it the minute there is any sign of it. But as you know, we are a long way in terms of medical research, either from gaining a full understanding of the causes of the over 100 different types of dementia, let alone finding a cure. But the welcome news out of the G7 decisions was a major step up in the funding of research into the causes and potential cures and treatments for dementia. And clearly a major milestone is hoped to be reached by 2025. And I welcome that, and I welcome the fact now that dementia is up there with many other diseases in terms of a commitment to increasing the research budget and the support mechanisms to be invested across the G7 and the G20, across Europe, and indeed across the world. Because we have to treat this as a high priority, because it is doing enormous damage to the life and the quality of life now of so many of our citizens, and it impacts immensely, not just on the people with dementia, but obviously on their families and their carers and their friends as well. Now, there is a great deal going on in Scotland that you probably have been told about or will be told about either yesterday or during the rest of today. But there are two or three particular initiatives I would like to draw your attention to, which I think are particularly laudable. First of all, one of the things we've done in one of our hospitals in Lanarkshire, and I think it's going to be repeated in other hospitals throughout Scotland, in the accident and emergency unit, we have set aside a special area for treating dementia, people with dementia. Because going into accident and emergency in itself for anyone is a very challenging experience, a very worrying experience. But if you have dementia, any change in your environment is frightening. To go into an accident and emergency department of a hospital is very frightening. And therefore, to have a special place as part of the A&E department where people with dementia can go is extremely important, particularly if the dementia is so advanced that the patient arriving in A&E cannot explain what has gone wrong and why they need to be admitted to A&E, and the chances are that's got nothing particularly to do with the dementia. It might be a broken hip, it could be a whole range of things, but as a hip patient, someone with dementia needs someone probably with them to explain what has happened to be treated properly. And I think that initiative in Lanarkshire is highly laudable, highly successful, and I would recommend it for every hospital in Europe, for every A&E department. Secondly, the work done in championing the issue of dementia. If Tommy Whitelaw is here, he no doubt will be already known to all of you. But Tommy nursed his late mother for many years and has now become a full-time champion, travelling the length and breadth of Scotland on the issue of dementia. And there are many other champions like Tommy, along with specialist dementia consultants in each of our hospital, in each of our health boards. And the work they are doing, I think, is extremely important because they're making people aware of the very special needs of people with dementia. For example, colour schemes, the layout of hospital wards so that people with dementia can see where the toilet is. Basics like that can transform the quality of life for people with dementia. And therefore, having a network of champions, a network of consultants, a network of people who are promoting and are aware of and are educating others about the particular needs of people with dementia, I think is making a substantial material difference to the quality of medical support that we have for people with dementia. And I would like to see that system rolled out, not just across the National Health Service, but throughout the social care and other services throughout the public sector, so that everybody, from librarians to nurses, from doctors to bus conductors and drivers, are made aware of the particular needs of people with dementia. And I think that would be a huge advance in terms of improving the quality of people living with dementia. So we have a very big agenda. We have many, many challenges. And of course, none of us in here know, irrespective of what age we are, if and when we ourselves are going to become people with dementia. And therefore, it is extremely important that each and every one of us, not just because we're interested or involved professionally in this subject, but every citizen should be aware of dementia, the importance of dementia, and the importance of being able to treat people with dementia with the dignity and autonomy that they deserve and require. Right from the beginning, we have based our policy, our strategy, and our delivery on the principles of the European Convention on Human Rights. People with dementia have the same rights as every other member of our society. It is our job, indeed it is our duty, to make sure that we ensure that those rights are respected and that we give people with dementia every possible support that we possibly can. I thank you very much indeed, and I hope you enjoy the rest of your stay in Glasgow and come and visit the other parts of Scotland which are even more beautiful. Thank you.